Well, Governor Brown is expected to make a decision today on whether 12 counties in Oregon will be moved back to the extreme risk level. This is due to an increase in COVID cases and rising hospitalization rates. The governor says if there are more than 300 hospitalizations in the state, she would adjust county risk levels. Well, currently there are 319 patients in hospitals across Oregon. The counties at risk of moving into the extreme category, you saw them there on your screen in red.
Marion County is one of those 12 counties in danger. Joining us live to talk about that is Marion County Commissioner Kevin Cameron. Good morning to you.
Well, good morning. It's good to be with you this morning.
Yeah, thanks for being here. So have you heard anything from the governor about this yet?
Oh, yes. Friday, I was in a meeting with her and staff and other county commissioners. And basically, at that time, we hadn't hit the 300 level statewide, but we have hit that number. I believe I saw an email last night that was 317. And a percentage increase is around 38% over the last 2 weeks. So my guess, it's pretty solid that we're going to get an announcement today that not only our county, but probably 12 to 14 other counties are going to move to extreme.
And so what are your thoughts on that? I mean, moving back to the extreme risk category, would mean that indoor dining goes away. We'd see some pretty drastic changes for some of the capacity limits for a lot of local businesses. Do you think this is the right move?
Oh, it's very difficult for businesses. I know we have to protect the public and their health. And one of the things we've recognized is the younger age group is where the cases are coming from. Even though we have a higher hospitalization rate right now, in the last 2 weeks, we've only had one death, whereas before when we hit those hospitalization rates, we were having, a lot more deaths. So I think it's tough, especially on the restaurant business. I know that personally. Restaurants that are opening and closing, they're going to lay off people. You just can't run a business like that. The one good thing I did see from the governor's office is they were going to increase outdoor dining from 50 to 100 capacity. Now, I don't know how many restaurants have the ability to increase to go to 100 outdoors, but that's going to give them some relief to keep operating because they know in nicer weather, outdoor dining is safer than indoor dining.
Yeah. Do you, in Marion County, are you all set up where, like in Portland, they have the parkades, they have the streets blocked off for restaurants to do that, especially as we head into these warmer months? Sure.
In the bigger cities, obviously, city of Salem and Woodburn and places like that, Silverton, they can do that. The rural restaurants, some of the rural areas of Marion County, because we're mostly a rural county, it's same way. They got to have the space to be able to do it, and then they have to have the equipment. They have to have the tents and the heaters, and those that have done this before, it will be easier for them because they've been through it before. But it's a really hard thing for our businesses, and then obviously for gymnasiums. And I know gymnasiums are one of the safest places. The way they sanitize their equipment and make you wear masks, etc. It's very difficult for these businesses to continue to operate, and there's obviously some that have failed already, others that may this time, because this is going to be weekly, bi-weekly. It's going to be measured every week, so it could be an up and down situation. They've taken away the cushion weeks on this. There's no 2-week notice anymore. You're going to announce it today, and Friday you're back to where you need to be.
Wow, that is a lot for businesses. All right, yeah. Well, Commissioner Kevin Cameron, thanks so much for joining us this morning.
Anytime. Thank you very much.
We want to go now to a county that is not in danger of moving into the extreme risk county right now, Multnomah County. Jessica Guernsey is a public health director there. Good morning. Thank you for joining us.
Good morning. Nice to see you.
So how are things looking in Multnomah County right now?
Well, as the commissioner just pointed out, and in your previous segments, you talked about, we're seeing a pretty precipitous rise in cases here in Multnomah County. Last week, we saw a 40% increase. We fielded over 1,000 cases last week. So we're seeing a pretty large jump that, we had been seeing for a couple weeks, but then really started to jump up last week. So we're extremely concerned. We know that, the good news is the weather's nice outside, so people can go outside. We feel like we're in our spring surge right now, but there is, somewhat of a light at the end of the tunnel, given that we have a vaccine.
Yeah, no, have you noticed, I mean, is one of the issues vaccine hesitancy? What is fueling this spike?
You know, in Multnomah County, I would not say that we're the predominant issue is vaccine hesitancy. We're a large county. The metro area in general is a huge part of the state's population, and really, we've had a hard time getting our numbers just because of the vaccine inventory and the allocation that we get. So I wouldn't say that our issue is vaccine hesitancy. The main thing we want to see right now is people getting vaccinated. That is a way that we can get out of this particular spring surge. And we want to emphasize that people should get both shots and wait 14 days after their second shot so they're fully protected. But that is one of the main ways that we are going to make it through this spring surge and move on with our lives, hopefully this summer.
Now, earlier on in the pandemic, there was a brief time there where the Tri-County area, Multnomah, Clackamas, and Washington were all moving together as a unit. Neighboring Clackamas County is at risk of moving back into the extreme category. So how close to that happening in Multnomah County are we right now?
Well, as the commissioner just stated, we've hit the benchmarks for Multnomah County. If the state decides today, if the governor decides today to move the handful of counties that you all indicated back into extreme risk, we've hit the markers to do that. I believe Clackamas County has as well. I don't think Washington County has. As far as I understand, unless something changes today from the governor's office, we're not tied together in terms of moving together as a region.
Okay. Well, when we spoke with Clackamas County's chair yesterday, she mentioned that there was an issue with enough vaccine doses. Has that been an issue in Multnomah County?
Well, that's what I was just saying. You know, we
Yeah.
have such a huge population here that to hit our benchmarks for some level of herd immunity, whether it's from vaccination or people becoming ill, because we did such a great job at the beginning of this pandemic, really flattening the curve. We have not had enough people vaccinated. Right now in Multnomah County, we have about 58% of adults have received one vaccine, and about 36% of adults are fully vaccinated. So we still have a long way to go. Those numbers are big, and we just want to emphasize again, the things that people can do right now. The main thing is to get vaccinated.
You know, we've heard from a lot of viewers, local business owners questioning why this move back to extreme risk in some areas. Are there other approaches we could take that wouldn't have the same economic impact? Do you think that this is the right approach?
Well, Multnomah County is working within the governor's framework, a statewide framework for reopening and risk categorization. So, you know, we're obliged to move with those decisions. I think we're seeing spread from a multitude of things. If I were really to focus on one thing for your listeners and your viewers this morning, I would say that, you know, there are three things that you can do right now for the foreseeable future that can make a difference. And we call it sort of the 2 out of 3 rule. Wear a mask, physically distance, and be outside. So if you can do 2 of the 3 of those, and of course get vaccinated, those are the big things that are going to make a difference right now.
Okay, Jessica Guernsey, Public Health Director in Multnomah County, thank you for joining us this morning.